Welcome students. Today I am going to take the class on lungs, anatomy of lungs. Since this is a revision class, I will be taking it in a short way but still try to cover as much as possible. So first of all, let us just see the shape of the lungs, okay? This is the right lung, left lung, you can see outer surface, inner surface. Both the lungs have got apex and base. Apex and base. Base which is concave from below, isn't it? Because the diaphragm, the thoraco-abdominal diaphragm, it has produced this concavity and the organs which are present below the diaphragm, isn't it? So apex, base, two borders are there, anterior border, posterior border. Anterior border is thin and the posterior border is rounded. So much rounded that it merges with the outer surface or the lateral surface. So this is the lateral or outer surface. This is the medial or inner surface or mediastinal surface. On the mediastinal surface, you can see this hilum of the lung. This hilum of the lung has got the attachment for the pleura, visceral pleura, parietal pleura. Like all the organs, lungs are also surrounded by two layers of membrane. So the pleura has got attachment on the margins of the hilum, and on the lower side, if you can see, it is very thin. So this is also called ligament, pulmonary ligament. And in this hilum, you can see this red color, blue color, and this normal color, I mean like gray color. So this is nothing but the pulmonary vein, pulmonary artery, and the bronchioles. And some pulmonary lymph nodes are also present over there, bronchopulmonary lymph nodes. So these things are present on the hilum of lung. So you know that it has got apex, base, two borders, two surfaces. And of the two borders, here you can see in the left side a notch. This is the cardiac notch. It is present on the left side only, I mean in the left lung only. And then you can see some fissures also. These dark lines are representing fissures. These fissures, this is an oblique fissure, this is also an oblique fissure, and we have got one horizontal fissure also in the left side, right side. That means the right lung has got three lobes, upper lobe, middle lobe, and lower lobe, while the left has got only oblique fissure, so it has got upper lobe and lower lobe. Okay, so this is about how many fissures are there, how many lobes are there present in both the lungs. Apart from that, there are markings also. Markings of what? The outer surface will have the markings of the ribs, because ribs are compressing the outer surface. Any structure which is coming in contact, it is going to leave a marking on it. And all the mediastinal organs, they are going to leave the markings on the mediastinal surface, isn't it? So it is going to have the cardiac notch, okay, cardiac impressions, okay, those depressions produced by various organs are called impressions of those organs. Cardiac impression, then you have got esophageal impression, then you will be having impressions of various nerves, phrenic nerve, right and left phrenic nerve, right and left vagus nerve, right and left sympathetic chain. All these are going to have markings on the mediastinal surface of lungs. And thoracic duct also. What is thoracic duct? It is the lymphatic duct which is conducting the lymph from the lower side of the body to the superior vena cava. So these are the impressions which are present on the medial surface of lungs. Now I come to bronchopulmonary segment. What is bronchopulmonary segment? Bronchopulmonary segments are anatomically and physiologically independent units of lungs. That means every bronchopulmonary segment will have its own terminal bronchiole, its own terminal branch of pulmonary artery, and the drainage will be done by its own branch of pulmonary vein and also the lymphatics. The only difference is that the bronchioles and the pulmonary artery branch, they will be present in the center of the lobe, but the vein and lymphatics will be lying on the margins, that means outside, between the two bronchopulmonary segments. So how many segments are going to be there? Although 3 lobes are present in the right lung, 2 present in the left, but the bronchopulmonary segments are equal in both. That means 10 in the right and 10 in the left. How? Now just see the names of them. This is number 1, you can see. Number 1 is apical on the right side. Then number 2, posterior, because it is present posteriorly. 3 is present anteriorly, so its name is anterior bronchopulmonary segment. We come to the 4th and 5th one. 4th and 5th both are present on the middle lobe of right lung. 4th is present on the outer side, so it's lateral. This is going, 5th one is going here to the medial side, so it is the medial bronchopulmonary segment. Then now we come to the lower lobe. This is the 6th. Now 6th is called the superior bronchopulmonary segment. Then the 7th is present on the medial surface. So 7, 8, 9, 10 all are called basal. But also we have to denote the position. So this 7 is present on the medial surface, so it is called medial basal. 8th is present here anteriorly, so it is called anterior basal. 9th is present on outer side, so it's the lateral basal. This is present behind 10th one, so it's called posterior basal. Now we will take up the left lung. See, in the left lung, this is the number 1. 1 is again apical. 2 is present posteriorly, so it is the posterior bronchopulmonary segment. 3 here. 3 is anterior. It's present anteriorly, so it's the anterior bronchopulmonary segment. 4th and 5th again. Since they are near the cardiac notch, so we call it lingula superior, and 5th is lingula inferior. This is superior, this is inferior. Now again the 7th bronchopulmonary segment is present on the medial surface, just like the right one. So that is called, 7th is called medial basal. 8, 9, 10. Again, anterior basal, lateral basal, posterior basal. This is anterior, this is lateral, this is posterior, and basal. Okay? And the 6th one, that was superior, so it's called superior. So these are the 10 bronchopulmonary segments present on each lung. Both have got 10 each, means total 20 we will be having. The 10 on the right, 10 on the left. Now the blood supply. As you know, the right ventricle, it is giving out the pulmonary trunk, which will divide into 2, right and left pulmonary arteries. The right pulmonary artery will go to the right lung, left is going to go to the left lung, and it is bringing deoxygenated blood. So that is the function of lung, to make that deoxygenated blood into oxygenated blood. So it is the function, okay, not the nutrition of the lung itself. So for the function of the lung, pulmonary trunk is the artery which is going to come and give the branches here for every bronchopulmonary segment finally. And after the function is over, that means after the deoxygenated blood has been oxygenated completely, or as much as possible according to the atmospheric pressure and the partial pressure of oxygen and carbon dioxide in the blood will be taken back through the pulmonary veins to left side of the heart. Left side of the heart, from where through aorta the whole body is going to have systemic blood supply. And when the whole body is having systemic blood supply, lung will also have. So it will be supplied by bronchial arteries, which are branches of thoracic aorta. So the arterial supply is going to be the bronchial artery. The veins will be venous drainage. Actual venous drainage will be bronchial veins. And as you know, the intercostal veins we have already seen. The azygous vein and hemiazygous vein, superior, inferior, they were the final veins which were receiving all the tributaries and finally draining into the superior vena cava. And lymphatics are also going to drain finally in the superior vena cava. Now the nerve supply is sympathetic and parasympathetic. Parasympathetic is by the vagus nerves, which is the 10th cranial nerve, and sympathetic by the sympathetic chain. So this was all about the lungs. In the revision class, I have in short tried to take as much as possible. Now I think you will prepare well for your exams. Thank you.